My name is Sharon Isaacs, and I'm a hospice nurse. One of the first concerns was having enough PPE in order to provide care safely for both myself and my patients. We had to put the PPE on outside, so if it was snowing or raining or really windy, I had to take my coat off to put the PPE on in this terrible weather. And enduring that was a trial, but it was worth it for my patients. I had one patient in a facility who, when she came onto hospice, they gave her just a couple of days because her lungs were so congested. And I applied our medications from our symptom relief kit. I visited her every day. I gave support to the family. And nobody expected her to survive more than a couple of days. And she not only survived COVID, but she was eventually discharged from hospice because she did so well with our care and our attention that, she became stable and was able to be discharged off of hospice. So I was very proud of that.
Wow, that's amazing. So we have a little surprise for you. We actually have a letter here from one of your patients that we'd like you to read.
We would like to recognize Sharon Isaacs for her outstanding care, efforts, and all-around service during the time of my dear husband's hospice care. From the start of care, Sharon showed professionalism and expertise. She was supportive and informative. We especially appreciated how she responded quickly to every call for help with detailed instructions. Every visit, she treated my husband lovingly and cheerfully. He looked forward to her visits, smiling and knowing help was on the way. He loved making others laugh and felt so comfortable with Sharon's cheerful demeanor, expertise, and warm bedside manner. We would exchange jokes at every visit, and it just made him laugh. And if he was in pain, he would say, "Oh my God, that was so great. I feel so much better now." Here are just a few specific examples that demonstrate how Sharon made a meaningful difference in the care of my beloved husband. She noticed his blood pressure was low, called his cardiologist, and changed the time of day he took his blood pressure medication. She noticed his ankles were beginning to swell and suggested he lift them for a number of hours every day. As a result, they returned to normal. When he experienced leg muscle cramps, she recommended more water intake and electrolytes, which resulted in the leg cramps disappearing. She also advised us to increase his protein intake to care for his skin, and as a result, he had no skin issues, such as bed sores, and his skin remained in wonderful condition through the end of his life. Sharon was swift to fill prescriptions and order supplies and equipment needed as his health declined and needs changed. As a result, he had what he needed at all times. Sharon was honest with all of us, answered all medical and end-of-life questions with sensitivity and comforting words. We cannot thank Valley Hospice enough for sending Sharon to us. It was a wonderful family. It was a wonderful family. It's very warming. It's what I went into nursing for. Working for Valley gives me that opportunity to be the real nurse that I always wanted to be. So reading this just makes me feel like I'm doing a good job.